This is iBreast Atlas. Breast cancer is one of the most common forms of cancer in women, no matter of race or ethnicity. In the US, there are more than 200,000 new cases every year. This leads to about 40,000 deaths annually. The risk of getting breast cancer is very low when you're in your 20s, but gradually increases with age. Getting lumps in your breast tissue is one symptom that breast cancer could be developing, so self-breast exam is key for early diagnosis.
iBreast Atlas is an app for personalized self-tracking of breast exams. The core technology which we present is the ability to take a picture with your smartphone, which will then render a 3D image or mesh of your breast tissue. This image will not be saved on the software, and only the mesh data will be stored. This is to respect the privacy of the users. Additionally, because it is an individualized image, the software can be used for both male and female users. The app will provide instructions for self-exam as well as additional resources. This app will provide logs of the time of the measurements, the location and shapes of the exam results, additionally to notify users of any changes within the measurements. Here we show an example of digital images conversion, which will be featured within our app. On the left, we have a sample of a round object. Next is the in-app image, which is used to both center and locate the breast tissue of interest. The app then, through various transformations, creates a 3D rendering of the object, as shown here. Lastly, it's rendered as a mesh and exported to the Atlas software, or within the Atlas software. We plan to design an in-house software for this, or to incorporate third-party software through licensing or other agreements, which have already been proven within the app marketplace. The current transformation is shown is via tri-dimensional software. This is what our in-app interface will look like to the user. This is modeled on an iPhone platform, which is one of the more common interfaces. The new user will select New Atlas, which is our map of the breast tissue. After doing that, they'll be prompted to enter their name. Once that's complete, they'll be prompted to create their atlas, which is to capture an image, and then through the rendering, which previously was shown, create the 3D mesh of the breast tissue. The user will then be prompted through a series of interfaces to log the location, shape, size, additional notes, and other prompts within our software. For location, the user will be able to drag and drop a marker to indicate accurately where the tissue of interest is. Various magnifiers or reductions of the size are available for improved resolution. Next, the size will be prompted to give the best estimate of the size of the tissue. Then the shape. We've selected round, elongated, and irregular. However, should we receive funding for this project, we will consult physicians to optimize the categories within these that the user will be selecting. Lastly, notes, which are to help the user further identify specific details about the tissue during their exam. Most commonly are known are skin irritation, swelling, pain, discharge, and lastly, we are able to incorporate a comment log that the user can then type specific comments for the record. Upon completing that, they'll be able to save and then add more points to their exam. Exit will be prompted to save and then store to the device. The next feature we're going to incorporate is in this resources, which will allow the user to have additional functionality. Firstly, the exam video, which will be the instruction for the self-exam. Next, email atlas. You can email to yourself or to a physician, which will keep the digital record and location and all the notes which you've stored. We anticipate a large user base, in which case a forum will be created so that users can discuss the app usage or various breast exam techniques. And lastly, using the GPS of the app, we'll be able to find local clinics. We believe this app will be of a great use to users because most women don't keep an active log of their exams. Additionally, the incorporation with the calendar of the camera of the phone will allow prompt notifications of when the users will be able to do their regular exams. And with that, we'd like to thank you. This final slide shows our advantages over existing technologies.